Merci. Hello and welcome to today's online virtual short course program with the title of Evidence-based Dentistry. Professor Hissari and I, Fariba Mutavassilian, are moderator of this program. Thank you all the audience taking time out being here with us for this short course program. I would like to appreciate Professor Khami, a faculty member of TUMS, Community Oral Health Department, for organizing this short course program. And this program is about 6 sessions, and I hope you enjoy it. As you know, evidence-based dentistry is an approach to patients' oral health care and requires the judicious integration of systematic assessment of clinically relevant scientific evidence relating to the patient's oral health medical condition with the dentist's clinical expertise and the patient's treatment needs. So the evidence-based dentistry bridges the gap between the research and clinical practice. I'm sure very useful and practical information will deliver to you in clear manner, and I fully expect that at the end of this program will influence your approach in dental practice, in research, in education, in any field you are. In this short course program, fabulous lecturer speak about different aspects of evidence-based dentistry. And now I would like to introduce today's speaker, lecturer. Our guest speaker is Professor Vitanen from University of Bergen, Norway, and Professor Khami and Professor Nekufar from TUMS. Professor Jörgen Vitanen has been a faculty member in the Department of Oral Public Health, University of Helsinki, Finland, and currently is working in the Department of Clinical Dentistry, Faculty of Medicine, University of Bergen, Norway. His expertise in the field of research and evidence-based dentistry will undoubtedly fortify our program. And now, about Professor Nekufar, I want to have a short, brief and summary of his resume, but he has a long resume and I have enough time to explain all the details. So you should just know he's an associate professor in the Dentic department and he's the director of international affairs of TUMS. He has a resume with many responsibilities, achievements, and publication of well-known journals, and all this cannot be presented in this short time. And Professor Khami received his PhD degree from Helsinki University in 2007 and is now working as a full professor in Community Oral Health Department in TUMS. He is also the head of Research Center for Caries Prevention in TUMS Research Institute and chief consultant of the TUMS Vice Chancellor for Global Strategies of International Affairs. We'll be running a live question and answer at the end of each session, about 15 minutes. If you have any question, you can write in the chat box as well. All your questions will be answered at the end of each session. Don't worry about it. Please, Professor Khami, stage is yours. Welcome, Professor Nekufar. Join to us. Most welcome, Professor Nekufar.
Okay.
Thank you. Thank you for presence.
Okay. In the name of God, the compassionate, the merciful. Okay, can you hear me? Do you have my voice?
Yes, Doctor, we have.
Okay, thank you. First of all, I would like to thank all the distinguished colleagues who kindly accepted to support our program, especially our international lecturers, Professor Virtanen from Norway, Professor Babu from UAE, and Professor Jacob from Malaysia, and also our professors in TUMS here, Professor Nekufar and Professor Shamshiri. We will start now the program. We now have a high number of participants, more than 300 colleagues and dentists and dental students from all over the world now have registered for this meeting. I know that maybe some of them just for some of the sessions, So I would like to thank all the participants and registrants. So when we have such a high number of participants, it is expected that they are not all at the same level regarding research and evidence-based dentistry. So for this course, we have a kind of a spiral design, meaning that first, for example, in this session, which is an introductory session, you will have an overall insight into the whole program, the topics that we will discuss more in the remaining sessions in the next days. And then in the next days, we will go deeper and deeper through the topics. And so we will expect those already familiar with the research and evidence-based dentistry to have a meaningful review and update regarding their skills and knowledge in this field. And also for the others, we expect that all the participants can acquire an acceptable level of knowledge and skills in this field. So now I start my presentation, which is Introduction to Evidence-based Dentistry, just to share some facts and figures, why we should be expert, why we should know, why we should be skillful as a dentist, as a clinical practitioner, why we should be expert in evidence-based dentistry and evidence-based approach. So let me, yes, I try to share my screen, and then so I've now shared my screen, but I think can you see my screen, my slides? If my colleagues tell me.
Yes, Dr. Khami.
Okay, you can see the slides.
Here you can be seen.
Okay. So, okay, yes, I'm Dr. Mohammad Reza Khami from Community Oral Health Department, and the outline of my presentation is this. You can see three main areas. What are three main reasons for being up to date in clinical practice? And then what are the main sources of information? And then just the definition of evidence-based dentistry as a starting point. So if you want to think about the main sources of information that we have, for example, in dental school when we are learning dentistry, and as an undergraduate students or postgraduate students, and then after graduation, it seems that there are three main resources for information. The first one is teachers and the educators in the dental schools. So the atmosphere of a dental school has been designed and planned just for learning and education, in addition to delivering healthcare services to the patients. But the main aim there in a dental school is education and learning. So our teachers and our professors and our educators are one of the main sources of information for us when we are learning dentistry, when we are in a dental school. We can ask them our questions when we have a problem, when we face a problem during treatment of a patient. They are ready to answer our questions. The second main resource for us is the textbooks. So we can have many, we can acquire knowledge through studying our textbooks. When we have problems, we can go to the reference books, textbooks, and study, try to find our answers. And then journal articles. Journal articles are our third main source of information when we want to do clinical practice. Regarding the textbooks, they are very good. They are very good. We know that they are very good. But there is a problem with the textbook. And the problem is that the information in a textbook may be outdated. This is because the process of developing and compiling a textbook takes a long time. There is a famous example of this. You know that HIV infection and HIV virus was first discovered in 1981 too. And when you go to the textbook of internal medicine, one of the famous textbooks in internal medicine, which is Harrison. And you go to the textbook, the edition published in 1984, meaning that at least 2 or 3 years after discovery of the virus and infection, you cannot find anything about HIV and AIDS in that textbook. So this clearly shows that there is a time, between when a textbook is compiled and published. So the information might not be updated. Okay, so and regarding our teachers, when we go to the topic of the level of evidence, then we will talk about expert opinion, expert committee opinion, and also the experience of our teachers and our clinical experience. And we will see how much value we can put on these sources of information when we want to use them as evidence for our everyday clinical practice. So why being up to date? This is a main question, and we should have a clear answer for that. Why do we need to be up to date when we are doing clinical practice? There are many reasons, surely, and you know that. But I just want to emphasize on 3 of them, which are maybe more important. The first one is a phenomenon called the slippery slope of clinical competence. So it says that expertise and effectiveness in some areas begin to deteriorate the moment that physicians leave medical school. When we are graduated from our schools, then we start to working. This phenomenon says that your clinical expertise will be decreasing and decreasing and decreasing through the time. So this is for physicians. It is surely true for dentists because we have many practical skills. Then the second main reason is consumer movement. We know that patients are starting to come to their dental appointments with information downloaded from the internet, some of which may be unfamiliar to the dentist. This is because of the new age of information and the new ICT information. All the information, many informations are now available for the patients. So we can compare the situation now with that, for example, 30 years ago. If a patient at that time wanted to have some information, for example, what is amalgam filling, what is amalgam, what is composite, what's the difference? So he or she should go to, for example, a library in a dental school, try to find some textbook, and then be able to read the textbook and understand the special terms and expressions. But now, just by some click in a mobile phone, it's possible to have many information. What is amalgam? What's the difference with composite? What are the characteristics of an amalgam filling? So many information. So this makes makes it necessary for us to be one step forward our patients, because if they, for example, ask a question and we don't know the answers, for example, about a new technique in bleaching, for example, in endodontics, for example, a new techniques, and if we don't know what is the answer, so it would be, I think, it is not good for a dentist. And the other point is that they are now aware of their rights. You know that the complaints, medical complaints of dentists and medical doctors now are increasing. There's a trend, increasing trend in all over, or in many, I think maybe all over the world, all of the countries. They have this trending of complaints from doctors and dentists because of patients. They are not the patients like, for example, 20 years ago, 10 years ago. They know they have rights. Even they want to participate and contribute to their treatment planning, and it is somehow their rights. We cannot say that, okay, no, I decide for your treatment plan. You cannot tell anything. This is my job. So the cooperative model of delivering oral health care services is now dominant instead of the paternalistic pattern that we had maybe 10 years ago or more. So this is the second reason that we should be up to date. We should have up-to-date information about our field and our clinical practice. And the third one, the last but not the least, the information explosion. We are now living in the era of communication and information skills. So, and now I want to tell something about this information explosion. So these, you can see some figures here. For example, daily 46 RCTs. And what is RCT? Certainly not root canal therapies here. It is randomized controlled trials that you know that it is one of the most expensive and most complicated types of studies. Many steps you should pass when you want to do a randomized controlled trial. So daily 46 RCTs are reported. 1,000 Medline new articles. And this one, Medline is just one of the databases that we have. It is a comprehensive database, of course, but we have other databases as well. So 1,000 Medline new articles per day seems huge. And if we go to biomedical articles and biomedical sciences, we come to the figure of 6,000. And this means annually 3 million articles. And if we think about the journals, 30,000 journals are published annually. The funny thing is that these statistics are for 10 years ago. And I purposely showed that here because you can see that during 10 years, of course, many of these figures now are much different than what you see here. So we have an estimation of doubling time of biomedical sciences. It has been about 19 years in 1991, but just 20 months in 2001. And it has been said that a general practitioner needs to read 19 articles every day for the whole year to be up to date. Oh, okay, it seems impossible. We have some other statistics about this doubling time of knowledge, biomedical knowledge, you can see here. So it has been 50 years in 1950, but 7 years in 1980, just 2.5 years in 2010. And it has been projected to be just 73 days by the year that we are in, 2020. Okay, so it just takes more than 2 months. That how much biomedical sciences that we have present after just about 73 days, we have it doubled. So I think these figures and these statistics clearly show that why do we mean when we are talking about information explosion. There are some other points. For example, students who began medical school in the autumn of 2010 will experience approximately 3 doubling in knowledge by the time they complete the minimum length of training, which is 7 years needed to practice medicine. So when we come to the students who will graduate in 2020, they will experience 4 doublings in knowledge. It is said that what was learned in the first 3 years of medical school will be just 6% of what is known at the end of the decade from 2010 to 2020. Okay, maybe you say that, okay, these are regarding medicine and medical practice, which we know that it's different from dentistry, but we can take a look. I have something about dentistry here, showing the number of articles published in and indexed in Medline. As I told, this Medline is one of the comprehensive databases. We have We do have a session on searching databases, and we will completely explain about the other databases. But this Medline is one of the biggest. So you can see the trend of indexing articles in this database from 2007 to 2017. The number you can see. And okay, about 10 million, more than 10 millions of articles have been indexed in this database. And if we come to the articles that have been indexed with dentistry as one of the medical subject headings terms, so with the medical subject heading terms of dentistry, we'll talk about this mesh in this session. Okay, it comes to about around. You can see here the number, around maybe 100,000, less than 100,000, and it stands about 1% of the whole articles published. Okay, it seems again huge. And the point is that this is just the articles that have been indexed by this dentistry mesh term. We know that in the field of dentistry, we have some other keywords, for example, oral health care, healthcare, dental health. So certainly the dental articles are not confined to just these around 100,000 articles. And also you can see the trend. So this was just an estimation of the amount of articles that are published in the field of dentistry. So I wanted just to show that what do we mean by information explosion. And then, okay, now but we have two important consideration here. Okay, we know that we have these high numbers of articles, but not all of this information is valid or useful for patient care. We know that many of these articles are, for example, in the field of basic sciences, which are really important, but it takes time that basic science study can have some clinical implications, are not related to our everyday clinical practice and for patient care. And the other point is that a little more than 1% of these articles are both rigorous and clinically relevant. So we have two problems here. First, the article should be relevant to patient care, and the other is that the article should be valid, a good study, a rigorous study. And as it has been said here, a little, just more than 1% is both rigorous and clinically relevant. So we can say that most research published in medical journals is too poorly done or insufficiently relevant to be clinically useful. Okay, so even you can see in prestigious journals, you can see some articles with certain deficiencies in, for example, the study method, in reporting, in conclusions. So just a small amount of these articles are useful for us. And the other very important point is conflicting findings. For example, we are searching to know, for example, for a periodontal disease, we are trying to know which of the two methods for periodontal surgery, for example, method A and method B, which of them are, for example, good, better, superior. Okay, then we search for articles and find 10 articles, and surprisingly, in, for example, 6 of them or 5 of them, method A is superior, has been shown to be superior, and in the 5 others, method B has been shown to be superior. What should we do? Which of these two methods are better, are superior? Okay, so this is very common. If you have searched for the answer for some of your clinical questions, you certainly have encountered this problem, the problem of conflicting findings. Okay, so Till now, we know that we have a huge amount of information published and reported every day. We have some clinical questions. We know that we should be up to date, but it is not possible to study all of the information that are published and reported every day. And we know that many of these articles are not relevant to our practice and are not good studies, are not valid studies. So what should we do? Okay, and at this point, we come to evidence-based dentistry. Evidence-based dentistry tries to solve this problem through an approach which have some steps. We will go through all the steps in our program, but just I want to this is the end of my presentation, just 2 or 3 slides, and just the definition of evidence-based dentistry. So the definition of evidence-based medicine, like many other topics, it has been started from medicine and then coming to dentistry. So the evidence-based medicine is the conscientious, explicit, and judicious use of best evidence in making decisions about care of individual patients. You can see here, evidence-based medicine is the integration of best research evidence with clinical expertise and patient values. I have bolded these 3 main items: best research evidence, clinical expertise, and patient values. It is important to know that evidence-based dentistry is just not about research evidence, but it tries to put research evidence along with clinical expertise of the practitioner and along with the patient preferences and values. This is very important, because if we just think about the research evidence and research studies, then maybe it does not work. So again, another definition of evidence-based dentistry, but with the same items, according to American Dental Association. So an approach to oral health care that requires the judicious integration of systematic assessment of clinically relevant scientific evidence relating to the patient's oral and medical condition and history, together with 2 other things, which are dentist's clinical expertise and the patient's treatment needs and preferences. So this is the definition of evidence-based dentistry. And then it is said that the most valuable application of the evidence-based approach to the practice of dentistry is to encourage the dentist to look for and make sense of the evidence available in order to apply it to everyday clinical problems. So this everyday clinical problems is important when we face when we face a problem in our clinical practice. We should be able to define it clearly. This is the first step as teacher, Professor Neko. Okay, can you hear me? Am I now connected?
Yes, now we can hear you.
Okay, just I finished just maybe one other slide. Okay, so I just share. Okay, so we should be able to define our problems clearly. This is the first steps. We should be able to search for the available evidence. We should be able to make sense of these evidences. We should be able to critically appraise the literature to find able to apply the evidences, and we should be able to evaluate the whole process. Okay, thank you everybody. If you have any question or comments, please just write down it in the chat, and then we will try to answer them as much as possible at the end of the 2 days programs. Now it's time for my dear colleagues and Professor Nekufar to continue today's program.